Welcome to While We Were Distracted, the podcast where we explore topics that often get overshadowed in the rush of daily life. Please take a moment to like and subscribe. It really helps.
Okay, so when you hear about this, the 2025 National Healthcare Fraud Takedown, it's being called the largest ever.
Yeah.
And the number they're throwing around, over $14.6 billion in intended loss. I mean, that's just jaw-dropping.
It really is. It completely blows the previous record. What was it, $6 billion out of the water? More than double.
Exactly. So what we want to do today in this deep dive is basically give you a shortcut to understanding what went down here.
Right. Unpack it a bit.
Yeah, unpack the staggering scale of it all. And, reveal some of the pretty surprising ways these criminals are gaming the system now.
Because it's getting sophisticated. We're talking global networks, advanced tech.
For sure. And we need to talk about the real human cost, too. It's not just numbers. And then finally, look at how the agencies, federal and state, are actually fighting back. They've got some new tools in the arsenal.
Yeah, some cutting-edge stuff.
So get ready for maybe some aha moments. This whole thing is way bigger and, frankly, more complex than you might think.
Absolutely. And just to give you a sense of the immediate scope right off the bat, we're looking at 324 defendants charged.
Wow.
And get this, that includes 96 doctors, nurse practitioners, pharmacists, people in positions of trust.
96 medical professionals.
Yeah. And this wasn't just one place. Charges across 50 federal districts, 12 different state attorneys general involved. It was huge.
And they got results quickly, too, right?
Yeah.
It wasn't just charges filed.
Oh, yeah, absolutely. They seized over $245 million in assets straight away.
What kind of assets?
Cash, luxury cars, even cryptocurrency. They went after the money.
Okay.
And maybe even more importantly, CMS, that's the Centers for Medicare and Medicaid Services, they managed to stop over $4 billion from actually being paid out on these bogus claims.
$4 billion prevented. That's
huge. And they also kicked 205 providers out of the system, suspended or revoked their billing privileges. So real teeth in the enforcement there.
That's good to hear. But, while those dollar figures are mind-boggling, you mentioned the human cost. It's easy to forget that part.
It is, and it's absolutely critical. Attorney General Pamela Bondi put it really well. She said, "These criminals prey upon our most vulnerable citizens and steal from hardworking American taxpayers."
So it's hitting people directly, not just the government coffers.
Exactly. And Matthew Galeotti, he's the head of the DOJ's criminal division, he pointed out something really crucial.
What's that?
That these schemes, quote, often result in physical patient harm through medically unnecessary treatments or failure to provide the correct treatments.
Oh, wow. So people are actually getting hurt by this. It's not just paperwork fraud.
Precisely. It's performing procedures people don't need or maybe not giving them the care they do need because the scam gets in the way. It's a direct threat to patient health.
That puts a whole different light on it. And I think I read there's a connection to the opioid crisis as well.
Yes, a very strong and worrying connection. Galeotti also noted these schemes contribute to our nationwide opioid epidemic and exacerbate controlled substance addiction. Well, think about it. Illegitimate prescriptions, pill mills operating under the guise of clinics. And Robert Murphy from the DEA had a powerful quote on this.
Okay.
He said, "Healthcare fraud isn't just theft, it's trafficking in trust. When doctors become drug dealers and treatment centers become profit-driven fraud rings, DEA will act."
Trafficking in trust. That's a chilling phrase. It really shows the overlap between financial crime and, well, a public health disaster.
It really does. And given that kind of impact, the level of sophistication we're seeing now and the global reach, it's pretty alarming.
You mentioned transnational criminal organizations, TCOs. They're involved in healthcare fraud now.
Deeply involved. In this specific takedown, 29 defendants were charged for their roles in TCOs. And listen to this. These groups allegedly submitted over $12 billion in fraudulent claims.
$12 billion, just from those TCO-linked cases.
Just from those. So yeah, we're way beyond small-time local scams here. This is organized crime, running like a global business, targeting healthcare systems.
Okay, so can you walk us through an example? Like, how does one of these massive international operations actually work? What did they find?
Yeah, probably the most eye-popping example is something called Operation Gold Rush.
Gold Rush, okay.
This single investigation, nationwide scope, involved the largest loss amount ever charged by the department in a healthcare fraud case. Ready for this?
Lay it on me.
$10.6 billion in fraudulent Medicare claims.
$10.6
Right.
billion in one operation.
Yep. It's almost hard to fathom, right?
How on earth did they even attempt something that big? What were they doing?
Well, the allegations are pretty wild. They apparently used stolen identities of over 1 million Americans,
A million identities.
all 50 states. And they used foreign straw owners, basically. People recruited overseas to pretend to own medical supply companies in the U.S.
So they'd fly people in.
Flew them in, set them up, all to hide who was really pulling the strings. They used encrypted messages, assumed identities from abroad. I mean, really cloak and dagger stuff. And they bought up dozens of these medical supply companies just to churn out fake claims faster.
So international cooperation must have been vital to catch them.
Absolutely critical. They actually nabbed 4 defendants in Estonia. Others were caught trying to flee the U.S. at the border. It was a genuine international effort.
That's incredible. So, okay, they file these bogus claims. What about the money? Laundering $10.6 billion, even if they didn't get it all, sounds complicated.
Oh, incredibly complex. They allegedly moved the money using things like cryptocurrency, a whole network of shell companies overseas.
Right.
All designed to dodge anti-money laundering rules.
Right.
They even arrested a banker accused of helping them do it.
A banker was in on it.
Allegedly, yes, facilitating the whole thing. Now, CMS did manage to block about $4.41 billion of those claims.
Okay, so a big chunk was stopped.
Yes, but that still means around $900 million was paid out, mostly by Medicare supplemental insurers. So they still got away with a lot very quickly. Shows how fast they move.
It's just staggering. And that's just one type of sophistication. You mentioned technology being exploited too. Something about AI.
Yeah, that was another really concerning one. A $703 million scheme involving marketing organizations based in Pakistan.
Pakistan. Okay.
They allegedly used artificial intelligence AI to generate fake audio recordings. Recordings that supposedly showed Medicare beneficiaries agreeing to receive medical equipment or tests.
Wait, they faked the consent calls using AI.
That's the allegation. Generated fake patient consent, then sold that bogus data to labs and equipment companies, who then used it to file false claims with Medicare.
That's next level. Using AI to manufacture evidence for fraud.
It shows how quickly these groups adapt and weaponize new technology, a really chilling development.
And the global reach isn't just networks, it's individuals running massive scams from abroad too, right? Targeting specific vulnerable groups.
Yes, absolutely. There was one defendant, reportedly based in Pakistan and the UAE,
Okay.
who allegedly masterminded a huge $650 million fraud scheme targeting Arizona's Medicaid program.
$650 million from overseas. How?
The scheme focused on addiction treatment services, but they allegedly recruited vulnerable people from homeless populations, from Native American reservations, using illegal kickbacks, basically exploiting people needing help.
That's awful.
And this individual allegedly pocketed at least $25 million from it. They tracked some of the proceeds to a $2.9 million home bought in Dubai.
Unbelievable. Just preying on the most vulnerable for massive personal gain.
It really highlights the predatory nature of some of these schemes.
It's clear the methods are just incredibly varied.
Yeah.
Let's talk about some of the other specific types of fraud you mentioned earlier. Prescription opioid trafficking. That's still a major issue.
Oh, absolutely. Still a huge and devastating part of the picture. In this takedown alone, 74 defendants were charged specifically for opioid-related offenses.
74. And how many were medical professionals?
44. Doctors, nurses, people who should be healing, not harming.
44. Wow.
And we're talking about the illegal diversion of over 15 million pills. Prescription opioids, other controlled substances.
15 million pills. Can you give an example?
Sure. There was one case in Texas, 5 people tied to a single pharmacy. They were charged with unlawfully distributing over 3 million opioid pills.
3 million from one pharmacy.
Yeah. Oxycodone, hydrocodone, carisoprodol, the usual suspects. This kind of thing directly fuels the addiction crisis on the street.
Right. Straight into the epidemic.
Yep.
And what about telemedicine? That exploded during the pandemic. Has that become a big fraud vector?
A prime target, yes. Very much so. 49 defendants charged in schemes related to telemedicine and also genetic testing fraud.
Okay.
The total intended loss there was over $1.17 billion.
$1 billion just in telehealth and genetic testing fraud.
Yeah. Often it involves these deceptive telemarketing campaigns. They call up Medicare beneficiaries, trick them into agreeing to medically unnecessary equipment, braces, walkers, that kind of thing, or genetic tests they don't need.
So they're exploiting the convenience, the remote aspect of it.
Exactly. Fraudsters are quick learners.
Yeah.
They adapt to new delivery models really fast.
Okay, what about wound care? That sounded very specific, almost
It
niche.
sounds niche, but the scale was enormous, and the conduct, frankly, particularly awful.
How so?
Charges against 7 defendants, 5 of them medical pros, for about $1.1 billion in fraudulent claims.
$1 billion for wound care.
For something called amniotic wound allografts. It's a specialized biological product, comes from placental tissue, meant for really serious wounds.
Okay, advanced stuff.
Right. But in these schemes, they were allegedly applying them unnecessarily to vulnerable elderly patients, people in hospice care even.
On hospice patients.
Sometimes without even talking to their regular doctor, applying them for superficial scratches or applying huge amounts way bigger than the actual wound just to bill for it.
That's a direct patient harm again, isn't it? On extremely vulnerable people.
Absolutely. Preying on the frailest individuals. It's pretty egregious.
And besides those big categories, you said there was a whole mix of other schemes, too. Any other sort of standout examples that show the variety?
Yeah, the other categories still added up to over $1.84 billion in fraud.
Wow.
And some were quite specific, like billing for medications that were never prescribed, specifically for injured United States Postal Service employees. That was a $28.7 million scheme.
Targeting postal workers. Okay.
And maybe even more disturbing, you had cases where medical providers were literally stealing drugs like fentanyl and hydrocodone meant for their own patients.
Stealing from patients.
Including children, stealing pain meds intended for kids. It's just a profound betrayal of trust at the most basic level.
Okay, so faced with all this, the scale, the sophistication, the global reach, the sheer variety of scams, it feels overwhelming.
Yeah.
How are law enforcement and the agencies actually fighting back? It can't just be whack-a-mole, right?
No, definitely not. And this 2025 takedown really signals a shift. They're calling it a whole-of-government approach. Meaning unprecedented coordination, federal agencies, state agencies, all working together much more closely than before. It's about presenting a unified front.
Okay, so better teamwork. But what about new tools? You mentioned new tools earlier.
Right. The really big development, I think, is the creation of the Healthcare Fraud Data Fusion Center.
Data Fusion Center, what does that do?
It basically brings all the experts together in one virtual place. You've got people from DOJ, HHS, OIG, that's the Inspector General's office, the FBI, other agencies.
All sharing data.
Exactly. And crucially, using advanced tools, cloud computing, AI, sophisticated analytics to sift through that data and spot emerging fraud schemes before they get huge.
So using AI to fight the AI fraudsters, in a way, being proactive.
Precisely. The goal is shifting from just chasing past fraud to actively detecting and stopping it before the money goes out the door.
Getting ahead of the curve.
That's the idea. CMS Administrator Dr. Mehmet Oz put it quite clearly. He said, through advanced data analytics, real-time monitoring, and swift administrative action, we're not waiting for fraud to happen. We're stopping it before it starts.
Stopping it before it starts. That's a powerful statement.
It's a fundamental shift in strategy. Proactive prevention, not just reactive enforcement.
And is part of this also about breaking down those bureaucratic silos we always hear about? Different agencies not talking to each other?
Yes, that's a key piece of it. This whole initiative is actually putting into practice a presidential executive order about eliminating those information silos to stop waste, fraud, and abuse.
Okay.
So by combining data teams, forcing collaboration, they're aiming for much greater efficiency. No more different agencies chasing the same leads in isolation. It's about unified intelligence.
Makes sense. So as we wrap up our deep dive here, it's really clear this 2025 takedown wasn't just another headline. It's a stark reminder of the sheer scale of healthcare fraud.
Absolutely. The financial hit is enormous, obviously, but the scope is so broad, touching everything from, advanced technology to basic patient trust.
And it impacts everyone, right, through taxpayer money, through the integrity of the system, and sometimes, tragically, through direct harm to patients.
It really underscores that this is a pervasive problem affecting the healthcare infrastructure we all rely on and hitting the most vulnerable the hardest.
But on the flip side, it seems the enforcement side is also evolving, becoming more sophisticated, more coordinated, using tech to fight back.
Definitely. The battle is ongoing, and the tactics on both sides are constantly adapting. It's a high-stakes game of cat and mouse.
So maybe a final thought to leave our listeners with. Given how adaptable these fraudsters are, how quickly they jump on new tech like AI, what do you think the next frontier for healthcare fraud might look like? And maybe more importantly, what's our collective responsibility in protecting these vital systems?
That's the billion-dollar question, isn't it? Where do they go next? And how do we, as a society, stay vigilant? Something to really think about.
Don't forget to like and subscribe for the next episode on While We Were Distracted.